Welcome to The Explainer. Today, we're diving deep into some fascinating expert insights from Dr. Sheldon Horowitz over at the National Center for Learning Disabilities. Our main goal here? To completely dismantle some of those incredibly common, deeply ingrained myths about ADHD. We're going to separate the cultural fiction from the clinical facts to really understand what's actually happening beneath the surface.
Okay, so let's just dive right in with a question you've probably heard thrown around casually at the office or maybe at a dinner party. Honestly, you might have even asked it yourself. Doesn't everyone have a little touch of ADHD? People say it all the time when they lose their keys or totally forget to send an email. But is there actually any clinical truth to that? To figure that out, here's our roadmap for this explainer. First, we'll tackle the distraction myth. Second, ADHD versus learning disabilities. Third, the diagnosis village. Fourth, holistic protocols. And finally, we'll navigate those common fears around medication side effects. All right, section 1. Is everyone a little ADHD? Let's unpack this distraction myth. Yes, it is completely true that everyone gets distracted. Everyone is at times impulsive. It's just part of being human, right? But clinical ADHD is fundamentally neurological. It's genetic. It's not just some fleeting moment of forgetfulness. It's a real condition that causes clinically significant problems across multiple areas of a person's life. We're talking severe impacts on school, work, and social functioning. It's a whole different ballgame. Dr. Horowitz actually hit the nail on the head when he said, each of us has features of ADHD, but not each of us has ADHD. Sharing a basic human trait, like, being easily distracted by your phone, absolutely does not mean you have a diagnosed neurological disorder. It's a really crucial distinction of scale and severity.
Moving right along to section 2, ADHD versus learning disabilities and understanding the brain.
Now, while these are two completely separate disorders, it is super easy to see why people get them confused. According to experts, a whopping 50%, literally up to half, of individuals who have a learning disability also have co-occurring ADHD. Because that overlap is just so frequent, they can look really similar from the outside. But structurally, they are entirely different beasts. The really crucial point here is their origin. ADHD has its root cause in chemical issues specific to the brain. Learning disabilities, on the other hand, stem from structural or functional brain issues. Think of it like this. They might be in the exact same zip code, but the architecture is completely different. And understanding this chemical versus structural difference, it's absolutely essential for getting the treatment right. Okay, section 3. Let's talk about how diagnosis actually works. Spoiler alert, it takes a village. See, the reality is that ADHD doesn't just magically switch on at 8 a.m. and switch off at 3 p.m. It doesn't just happen in a classroom. It happens at home, out in the community, during soccer practice or piano lessons. It is pervasive. So because of that, any valid diagnosis absolutely cannot be based on academics or classroom behavior alone. Getting a proper diagnosis requires what we call the comprehensive evaluation village. A medical provider has to drive the bus, for sure, but they aren't working in a vacuum. This evaluation gathers critical input from physicians who know child development, parents, psychologists, speech-language pathologists, and, yes, teachers. Literally anyone who has meaningful contact with the child feeds information into this evaluation. It's a complete 360-degree look at how the child is functioning, not just a quick snapshot for math class. That brings us to section 4. Treatment beyond the pill. We're looking at the holistic protocol. First off, we've got to completely shatter this failure myth. The truth, many individuals with ADHD are highly successful and extraordinarily competent. ADHD does not equal a doomed academic or professional life. No way. The real secret to their success is self-awareness, knowing exactly what they need to succeed, and having the right holistic support systems securely in place. So what does that support system actually look like in the real world? Well, carefully monitored medication is often a very important core part of the protocol, but it's really just the foundation. Psychological therapy is hugely effective. Behavioral coaching provides enormous benefit. Even simply managing diet, nutrition, and stress levels can dramatically change a person's trajectory. Add in proper workplace or school accommodations, and you have a true recipe for success. It's an entire ecosystem of support, folks, not just a prescription pad. Finally, section 5, navigating medication side effects and confronting those fears. Let's just tackle the top 4 fears parents have head on. First up, zombie-like behavior. Listen, if a child looks drugged, the medication protocol is simply wrong. Full stop. Second, diminished appetite. Stimulants can absolutely suppress hunger, but this is temporary and easily managed just by supplementing their diet before the meds kick in and after they wear off. Third, short stature. While long-term use can sometimes cause slight delays, studies show kids almost always catch up. Usually the max difference is only an inch or two. And fourth, sleep problems. The rebound effect when medicine wears off can cause a temporary crash, making them irritable or wide awake. But this is a timing issue that a physician can easily help you schedule around.
And then there's the big one, the ultimate fear, addiction. Parents worry, quite naturally, that giving kids these drugs will make them addicts later in life. But the medical consensus actually flips this fear completely on its head. Teenagers are already prone to risk behaviors, but leaving ADHD untreated? That's what actually increases the risk of them trying to self-medicate with alcohol or illicit drugs.
Just like Dr. Horowitz points out, careful and responsible medication management over time absolutely does not lead to the abuse of these medications. Proper, responsible medical management by professionals is the ultimate safeguard against addiction, not the gateway to it. It stabilizes the individual so they don't even have to seek out those dangerous alternatives.
We've covered a tremendous amount of ground today, tearing down those old myths and replacing them with hard clinical data. So, armed with the clinical facts, rather than the cultural fiction, here is my question to you. How will you step up today to better support the individuals in your life navigating ADHD? Whether it's shifting your own mindset, advocating for a proper comprehensive diagnosis, or helping someone build that holistic treatment protocol, knowledge is really only power if you apply it. Thanks so much for engaging with this explainer. Keep learning and keep questioning those myths.